This is Dirty Harry. He needs a wash. As OTs, we need to be cognizant of the variety of injuries that can result from different occupations. These include injuries resulting from poor techniques and habits, as well as those from repetitive actions, often unnatural but necessary for the occupation. We'll examine the occupation of dog grooming to demonstrate how poor technique and repetitive actions can lead to musculoskeletal injuries and pain. For professional groomers, there are a wide variety of injuries that can be incurred, particularly in the lumbar and upper limb regions. Today we'll be focusing on the actions involved in washing, as well as repetitive actions involved in cutting and brushing a dog's coat. As you can see here, our groomer is flexing her trunk with her knees in an extended position. Normally, the body's centre of gravity is located anterior to the second sacral vertebrae. However, when she's flexing her trunk forward with knees extended, she has shifted her centre of gravity outside her body, stressing her back extensor muscles to maintain balance, and thereby creating a less stable base of support. To pick up the dog, she flexes her glenohumeral joint using her clavicular pec major, anterior deltoid, short head of biceps brachii, and coracobrachialis. Movement occurs at the scapulothoracic joint as it rotates upwards, elevates and protracts in the scapulohumeral rhythm with the glenohumeral joint. Concentric contraction of the upper traps, lower traps, serratus anterior, pec minor, levator scap, and rhomboids facilitate these movements. Our dog groomer also engages her rectus abdominis, external and internal obliques, and psoas major muscles to flex her trunk. Her back extensors, erectospinae, gluteus maximus, and hamstrings are also under pressure in this position, working eccentrically. With the load so far from her body, the glenohumeral flexors and stabilizers, that is to say the rotator cuff muscles, as well as the scapular protractors, are also under stress. Here we have our groomer placing the dog in a low bath. Our groomer is now rotating her trunk using her ipsilateral internal and contralateral external obliques, along with her QL. Harry is held in an extended position prior to being placed in the bath. Again, her centre of gravity is shifted in order to control moving the dog into the bath. If our lovely dog groomer was to proceed to wash the dog at this low position, her trunk will be flexed for an extended period, creating considerable stress on her back extensors, acting eccentrically. Such a position could lead to viscoelastic creep, whereby the back extensors decrease in activity, leading to the posterior ligaments taking load, overstretching, and increasing the possibility of a disc injury. Many of us are guilty of performing lifting actions like this, often resulting in injuring ourselves in the process. Injuries that result from poor lifting technique are predominantly the result of rotating the trunk while under the load of extra weight. It's also possible with repetition of poor technique that other problems may arise, like piriformis syndrome, sciatica, or disc injuries. Being mindful of our actions as we do them ensures that we are minimizing the chance of injuring ourselves. Here we see our groomer is first establishing a stable base of support by facing the dog, her feet slightly apart. The dog is tethered to a fixed point, thus decreasing the likelihood of the need for the groomer to engage in any sudden movements that could place undue stress on the body. As she squats, the extensor muscles of the hips and knees are undergoing eccentric contraction to lower herself down with control, and her spine is remaining in a neutral position. By flexing her glenohumeral joint and elbow, she ensures that she has a firm hold of the dog with the load equitably distributed between her upper limbs. The flexor muscles of her hips and knees work eccentrically to return her to an upright position. The groomer then turns her whole body so that she is facing the sink. She then eccentrically contracts her quadriceps and slightly flexes her knees to lower the dog into the sink. This series of movements both avoids twisting her torso and placing stress on her lumbar region. By carrying the load close to her body, she is maintaining neutral spine as well as ensuring her centre of gravity remains within the base of support, thus minimizing stress on her muscles. She has opened the cupboard to rest her foot in an elevated position to ensure a more stable base of support and reducing the need for lumbar flexion. Grooming your dog has the potential for causing repetitive stress injuries. The likelihood of injury can be reduced through preventative measures. Something as simple as spreading the workload through using both hands instead of one, or incorporating the use of ergonomic aids, can significantly reduce the risk of stress and injury. Brushing usually involves extended periods of flexion of the glenohumeral joint, which is also slightly internally rotated. The brushing action is a repetitive action that can result in stress and inflammation of the elbow joint, potentially resulting in conditions such as tennis or golfer's elbow. Tennis elbow, or lateral epicondylitis, is an overuse tendinopathy of the lateral wrist extensor muscles where they insert at the elbow. Golfer's elbow occurs at the medial epicondyle. Cutting a dog's coat involves repetitive stress on the distal radio-ulnar joint and thumb joint, as well as the carpophalangeal joints. The continual flexion and extension of your hand joints can lead to inflammation and pain, including conditions such as carpal tunnel syndrome. Preparing muscles for the work they are about to perform, as well as taking breaks to allow muscles time to rest and recover, is an important factor in reducing the risk of musculature stress and strain. Here we have our dog groomer performing some examples of stretches for the flexors and the extensors of the forearm, as well as pectoralis major. Firstly, she flexes at the elbow, holding her arm into her body. She then pronates her forearm and extends at the elbow and glenohumeral joints. Keeping her wrist in an extended position, she applies gentle pressure with her other hand, stretching her extensors. The same is repeated for the flexors, but with the forearm in a supinated position. In this position, the muscles being stretched include the flexor carpi radialis, palmaris longus, flexor carpi ulnaris, flexor digitorum superficialis, and flexor digitorum profundus. The main flexors of the glenohumeral joint, pectoralis major and anterior deltoid, also need to be stretched. Our groomer abducts and externally rotates her arm at the glenohumeral joint with a flexed elbow. Leaning into the cupboard, she is able to stretch the clavicular end of pec major and her anterior deltoid. Of course, there are a number of alternative stretches available if these examples don't suit you, such as the Buddha or reverse Buddha for the arms, or the double leg lift for the abdominal wall. It's important that these stretches are performed before, during, and after grooming your dog. These types of stretches are crucial for professional groomers who perform the repetitive actions for hours at a time. Anecdotal research suggests that repetitive injuries such as carpal tunnel syndrome are prevalent amongst professional groomers. There are a broad range of aids to assist professionals, including electric tables that can change height depending on the size of the dog, as well as cushioned mats to elevate pressure from being on your feet for extended periods. For the casual dog groomer, performing the correcting lifting technique and minimising rotation with a load, as well as performing the stretches demonstrated both before, after and during grooming, can alleviate tension and stress in the muscles. And of course, if you can't be bothered with any of this and you want to avoid injury, there is another easier option. This video was produced by Sarah Forbes, Arabelle Ebitash, Samantha Renton and Vanya Bromelo, and no animals were harmed in the making of this video.